right, so this is an 81-year-old male. He's had severe right knee pain for many years now. He's failed all conservative management, which has included physical therapy, corticosteroid injections, anti-inflammatory pain medications. He feels it's interfering with all aspects of his life, and we're planning for a right Mako total knee arthroplasty today. He really wants to get back to playing pickleball, going on longer walks, and those things are really being inhibited right now because of his severe knee pain. So we're using the Mako Robot. It helps us make more accurate cuts. It also helps us resect less bone, and we can plan exactly what we're doing before we make any cuts to the bone. So we look forward to getting this gentleman a new knee. This is our pre-op imaging. So we look at our sizing on our femur, make sure that it matches the patient's natural anatomy. Then we look at the tibia as well to make sure that that is appropriately sized. We can look at the rotation. We can look at our approximate bone resections, which we will make adjustments to intraoperatively based on ligament tensioning. Okay, so here we're going to be capturing the patient's native hip center. We're going to get the natural range of motion of his, or pre-op range of motion of his knee. So we're looking at the medial malleoli, lateral malleolus. We're capturing our checkpoints. We already have our femoral and tibial arrays placed. So next we're going to be capturing points on the femur and on the tibia, and they're going to compare that to the patient's preoperative CT scan. So we finish our registration, and here we're checking the patient's native alignment and range of motion. We're also assessing his ligament balance. We've made our plan. Now we're going to use the Mako Robot arm to make our cuts. So here we're trialing. As you can see, we've corrected his flexion contracture, overall alignment. We've left him in a little varus, which we planned for. Overall alignment's about 5 degrees or so of varus. Let me check our laxity or our balance and extension. Good. Just kind of what we want, about a half medially and 1 or so laterally. Everyone's knee is a little bit looser posterior laterally in flexion, which we like to leave them at. We like the medial part of the knee to drive their kinematics, especially in the setting of a varus knee. Good. So here what we're doing, we're sizing our tibial component. We're assessing our cuts. With the Mako Robot, we're able to make much more accurate bone cuts. And all those trials fit very flush, so we'll be very comfortable using press fit fixation. In between the knee, we have a piece of called polyethylene that becomes the bearing surface between the femoral component and the tibial component. And here we are impacting the femoral component into place, and because our cuts are so accurate with the Mako Robot, again, we're able to use press fit fixation, and that feels like a great knee.